Colleagues, ladies and gentlemen, it's my great pleasure to share with you at this session smart wearable device in the management of heart failure. So wearables in healthcare is actually miniaturized electrical device with sensors worn on the body or integrated into clothing or other body-worn accessories, which is capable of invasive longitudinal monitoring of vital parameters, and the data transfer across devices is actually via through wireless technologies. We are getting familiar with all these wearables like a vest, shirts, necklaces, glasses, watches, and there are different types or modalities of sensors as accelerometer, which measures the acceleration of the limb, a full body ECG, as said by Dr. Hiroshi, and SCG, simulcardiogram, which measures the mechanical activity of the heart, like valve opening and closing, and the third heart sound, like that. So artificial intelligence in healthcare consists of two key terms as machine learning and deep learning, and which makes the devices smarter. And that can be applied in the management of heart failure, such as continuous monitoring, quantitative assessment, and volume management, like remote rehabilitation, and more importantly, which is useful in predicting the events like heart failure rehospitalization. However, there are several limitations of current wearables, like such as the data need to be interpreted by clinician. They're just simply machine learning-based algorithm. So a lack of adequate medical explanation, and it also requires 24-hour coverage of device alerts. And by using the continuous monitoring of vital signs, and the wearables actually help help to conduct supervised lifestyle modification in patients with risk factors of heart failure. So say the management of hypertension and diabetes, so to prevent heart failure from stage A to stage B or stage C. The smartphone-based wireless single lead ECG that we are all getting familiar with, like the iPhone, the Apple Watch or Huawei Watch, that can used for screening for paroxysmal atrial fibrillation in heart failure population, and hence decide the anticoagulation therapy. Remote dielectric sensing, known as REDS, is actually a very smart wearable to see the degree of pulmonary edema in patients with heart failure by measuring the intrathoracic impedance. The early study actually tested the ability of REDS to detect pulmonary edema in patients who discharged from a recent acute decompensated heart failure. And compare the parameters during the REDS, so-called the REDS phase or REDS period, compare it with the pre and post REDS period. And during REDS period, the physician adjusts the dose of diuretics according to the REDS value, and we can know from the study that in REDS period, the rehospitalization was significantly decreased compared with pre and post REDS period. A recent published REDS safe heart failure study was randomized control study, including 100 patients hospitalized with acute decompensated heart failure, and to test the ability of risk-guided therapy, including diuretic adjustment and GDMT, with routine care in if there are difference between in primary outcome in 30 days. And we could see from here that the risk-guided therapy actually resulted in 30% of reduction in relative risk for the primary outcome. However, when comparing the side effects of risk-guided therapy, there was no difference between the control group. This Fitbit watch could monitor continuously real-time the heart rates, blood oxygen saturation, skin temperature, and sleep quality, and also do daily step count. And it was found in this study that this step count associated with the status at baseline and over time in heart failure patients. So it could assist the home-based cardiac rehabilitation to improve exercise intolerance and lower extremity muscle strength in those tested heart failure patients. You know that the heart failure has the higher event rate, like the higher heart failure rehospitalization. So if there is an immune system for the heart failure exacerbation would be great. And this device actually cooperated those parameters like heart rate variability, arrhythmia, respiratory rate, growth, activity, walking posture, like that. And they use machine learning technologies to build a personalized health models for each patient that they use the model at discharge at the baseline, and the monitor if there's model changed over time, if there's a difference between the actual monitored signs with the baseline model, and it alerts. So the Link Heart Failure Multicenter study actually used this kind of device, and the result shows that the device actually detected precursors of heart failure rehospitalization with a high sensitivity and specificity. And more importantly, the median time between the initial alert and heart failure rehospitalization is 6 days. So it gives us a quite long time for early intervention to prevent heart failure rehospitalization. So from this chart, you would see that patients with alert, showing here as the red line, and those without at the green line. So there's a big difference between the event-free survival between the patients with alert, in green line, or those without alert in the red line, in terms of heart failure rehospitalization and not unplanned hospitalization. So this flow chart actually shows the development process of ideal alarming system, from acquiring and processing data and building a platform. So it starts with the acquiring of different data sources to data cleaning, artificial intelligence, health data platform, and integration into clinical practice. So the flow chart. So as a clinician, I think we have to think about two things. Among all those data sources, what kind of data is actually could be acquired the data acquisition is reliable, feasible, and convenient that can be incorporated into a patient's daily life. And the other thing is that what is the triggers or the common pathway that could alert an event in heart failure patients? So let's look at look back to those so-called stable chronic heart failure, compensated heart failure patients. We know from this chart that 2/3 of those chronic heart failure patients actually is most hypervolemic with volume overload. In acute heart failure, about 90% of 9% of those acute patients is actually congested, volume overload. So I think you have to agree with me that congestion is the main factor that determines the natural cause of heart failure. But from hemodynamic congestion to clinical congestion, there are quite a relative, a long way to go. Say, it might leave us several days for intervention. If there's several days from hemodynamic congestion to clinical congestion, and it also gives us opportunities for early intervention from underneath the sea to above the sea. So we all know about the CardioMEMS and Cordella heart failure system. Both are implantable devices for the measurement of PA pressure. And it has been approved that based on the transmitted readings of the PA pressure to clinician and this based treatment adjustment helped reduce mortality and heart failure hospitalization in patients with heart failure. And recently, Wearable seismocardiography combined with machine learning, and like this device, actually they non-invasively measure pulmonary artery mean pressure and pulmonary capillary wedge pressure, PCWP, by using these wearable devices. And there is a study to test the correlation of this device, of this method, with the subclinical or PA pressure elevation or subclinical congestion. So based on our own study, by using lung ultrasound, we have found that at discharge, although some patient has been labeled as clinically dry, decongested by using B-line, we also could identify some patients with subclinical congestion, and those patients showed a worse prognosis and more heart failure rehospitalization during 6-month follow-up. So we believe that congestion is one of the main reasons for the aggravation of heart failure symptoms and heart failure hospitalization. This could be recognized as a trigger for heart failure events and used as the main parameters for variable devices combined with AI technologies to develop a wearable parameter for subclinical congestion. So this congest heart failure study actually do this pilot work by using the cardiopulmonary monitoring, CPM, in some patients with heart failure, hospitalization, some patients before and after hemodialysis, and some patients undergoing right heart catheterization. Actually, they use intrathoracic impedance, the third heart sound energy, or tidal volume, trying to associate it with the readings of weight, volume removed, by dialysis or lung ultrasound. And the study showed that in all cohorts or the subcohorts of heart failure, there's a good correlation between these CPM ratings with the weight loss or weight reduction. And our team worked with the Artificial Intelligence R&D Center from Military General Hospital, the Professor Zhang's team. We work on these continuous monitoring multiple the monitoring systems which continuously monitor multiple parameters as ECG, respiration, blood oxygen saturation activity, and like this vest. And we had some pilot results to show that actually these monitoring parameters actually showed correlation with a degree of congestion in heart failure patients. So in this pilot cross-sectional study, including 36 heart failure patients versus 30 normal control, this wearable detected amplitude of breathing in the chest and abdomen. And we found that in heart failure patients, there's a changed coordination of chest and abdominal breathing. And in this study, we included 18 heart failure patients with pulmonary edema shown by lung ultrasound B lines and 44 without a pulmonary edema. The wearable device acquired sample entropy, short as sample in. It's a parameter assessing the complexity of breathing, of physiological time series signals. Breathing, actually. It has been shown in those patients with pulmonary edema, they showed a similar breath rate complexity, but more complex in breathing amplitude, more complex in breathing amplitude. Here show you the difference between the patients with pulmonary edema and those without, as shown here. That was our pilot work on wearable device and subclinical congestion. So our future perspective would be like that, to build a smart alarming system with a smart device, starting with the patient wearing a vest or wearing a shirt, and ends with the monitoring station, patient's pads, and collaboration with between nurses and doctors. And also a smart management pathway based on traditional education, self-management, as blood pressure, heart rate, weight, or congestion symptoms. We inputted smart wearable parameters to build an alarm of a worsening heart failure and to give the give the sign to the heart team who received alarm, and to do an early intervention and trying to prevent effectively heart failure rehospitalization. So I think that's is our future perspective. Smart management pathway based on smart alarming system. Thank you. That's my talk. Thank you. Thank you so much.